Mr. Snyder has played an integral role in passing multiple local initiatives as well as Proposal 1. He's not only an activist but also a patient. He has a bone disorder called nail patella syndrome. 7 years ago, he discovered that the federal government was supplying 5 remaining patients with 300 marijuana cigarettes a month, and one of the 5 also had NPS. George McMahon had been receiving his marijuana for over 20 years. Immediately, Mr. Snyder made up his mind to turn the seeming curse into a blessing by showing the inconsistency between how Mr. McMahon was treated compared to himself being persecuted. Having co-founded the Flint Coalition for Compassionate Care, Mr. Snyder speaks fluently about both medical and political aspects of medical cannabis. Mr. Snyder should be an inspiration to all who seek a more free Michigan.
I just normally bring this can that George McMahon gave to me. I held a press conference in 2007 in Flint when we were passing our initiative, and he was nice enough to give me one of these to use as a teaching aid. But it's not going to do good up here. Maybe I could pass it around and everybody can take a look at it. It's kind of neat to look at and to see the basically a can that's part of a regulated distribution system that's working. Here it is.
What was in the can?
That was where the 300 marijuana cigarettes came in the can, and then it gets distributed to each of the 5 patients' doctors, and then they pick it up from their doctor. I would like to talk about the stories and experiences that helped lead me up to the present. And first, I guess I'll start with just a little bit about myself and my disease. I'm 31, I'm married, and I'm a father of a daughter and a possible son or daughter. And I was born with nail patella syndrome. It's a neuromuscular skeletal disorder. It has internal and external symptoms. It's congenital and genetic. It's my hope that my personal experiences can help illustrate the importance of reintroducing medical cannabis, cannabis for therapeutic purposes into our society, and the pitfalls that I ran into, and which many untold others run into when they don't acknowledge the medical legitimacy of cannabis. I was willing to endure the hardships of, which is a prerequisite for change sometimes. Yeah, even if one ill individual can benefit legally from the drug and get some kind of pain relief as a result of my activism, then I feel as if my mission has been accomplished. And with medical cannabis, the predominant things that exist within nail patella syndrome are just, which is not as painful as you might think. Nails, thumbnails are the main nails that are missing in NPS patients, and then from the pointer finger out in that order, they can get worse, starting at the thumbnail. That's the least of the problems, but that's the very, the visible thing that people are able to, notice and quickly be able to recognize nail patella syndrome. The main part for me is it manifests differently within each patient. So the thing about nail patella syndrome, which growing up and as a child, right off the bat when I was born, the doctors didn't know if I'd be able to walk, and my mom was real distressed because I had a clubfoot deformity and my feet were just all twisted and mangled. This is all from what I've seen from pictures, obviously, and have heard. And fortunately, because of medical technology, they're able to slowly cast it and use corrective shoes to bring my straight child as a kid. You don't really think about the pain and stuff that's occurring, but as I got older in life, I remember going back, I always experienced joint pain, and whenever I tried to push my body, I would get achy, and I just couldn't seem to excel in sports type activities and competitive type things like that. So fortunately though, my parents always encouraged me to keep trying, say no, how dare. And I think it's kind of funny because I was actually on the front page of the paper with the Just Say No parade when I was a kid, and I think about it. But not really very funny when you think about it, because Nancy Reagan, who helped basically push the Just Say No era, actually has presented the certificate of heroism to George McMahon at the height of the Just Say No drug era. If I would only known then, you know, and even in my teenage years, because as I was, when I was 22, I got into a car accident. That was my trauma. That was in 99. And after that, I required a surgery, and just things started to go really rather downhill. And that's in 2001. By 2001, I had received multiple surgeries, pins in my hand. And as a result of that, I started to get pain medication for the surgery, and that's when my first real long-term addiction. I got bedridden a lot, and I didn't know what to do. And I was opening up an email one day, and in that email I read about an individual who received 300 marijuana cigarettes from the government a month, and that he had all these similar symptoms, and I thought it was rather odd that he had all these similar symptoms. And I read a little man was, I think he was the 28th legal patient. He got into the program in 1989, and so I started reading about it, and immediately the light bulb went off in my head. If he has the Alpha syndrome and he's getting his medicine and receiving the certificate of heroism, and and I also didn't mention some of the little run-ins. I've actually got in trouble for one marijuana cigarette, and that gave me a 45-day sentence in the middle of my senior year for 0.06 grams of marijuana. So I knew that it worked just through. The moment I use it, I feel better, and I don't have any negative side effects. That summer, Tim Beck had started the Detroit Coalition for Compassionate Care, and actually, if anybody deserves a lot of thanks for getting everything started in Michigan, it was Tim for getting the Detroit Coalition for Compassionate Care started and running. He was one of my mentors, and that's exactly what I modeled. Me and Brian Morrissey modeled the Flint Coalition for Compassionate Care after the Detroit Coalition for Compassionate Care. But in that 2004, it was Tim had worked to get it on, and the petitioners had worked to get it on the primary, the August primary of 2004. So we did. I helped get out the vote. We went around, drove around with a megaphone in Detroit, and vote for. I forget what the proposal was for Detroit, but vote yes on M, and we had a run-in with the Border Patrol. That was pretty funny, and they buzzed us. It was they didn't know what to think of us with the megaphone on top of the van and medical marijuana signs all over we couldn't even see through the back window because of the signs, and we kind of felt at a certain point it was you could almost feel them their eyes burning through us, and then they kind of they were right up on us, and they slowly just buzzed us, just totally punched it, and made their presence known in a rather kind of after the primary party, and we witnessed the history of Detroit being the first legal local initiative here in Michigan. And it was exciting at that time, and I remember Tim saying, Ann Arbor, Detroit, Ferndale, and Flint is what we're going to try next. And I immediately saw the fact that Flint was really doable, because Flint's kind of if you ask me, a microcosm of the macrocosm of Detroit, a smaller version, just with the auto industry. And an aspect of these local initiatives is that they were achieved by a small group of thoughtful committed citizen